For this video, I am going to discuss a situation that happens occasionally to my patients, and I feel like we need to address this in detail because we might be able to avoid complexities in the care of the management of Parkinson's disease. So that particular situation is whenever you end up going to the hospital for any situation. For example, if you go to the hospital because you need to have surgery in your knee, if you go to the hospital because you need to have some sort of elective procedure, you will be able to prepare and be ready. However, people that end up in the hospital in an unexpected manner, sometimes they will end up facing multiple complexities. So let's go ahead and try to figure out how to minimize this. So typically, people with more advanced Parkinson's disease are taking combinations of medicines that it could be possible the hospital pharmacy will not have it available. So you know what is going to happen, right? It is going to be critical for you to bring the medicines yourself and just present all this to the pharmacy in the hospital in order for them to be able to continue with the regular treatment that the patient is taking at home. So let me tell you what my recommendation is. So in first place, you need to have an updated list of the medications that you are taking for your Parkinson's in this bag. So you need a bag, something like this, right? So inside this bag, you need to have the current medicines that you are taking with the particular or the specific dose of the medicine. And also you need to write down the times that you're taking the medicine. It is not only that you're taking carbidopa, levodopa 4 times a day, but you need to write down, I am taking carbidopa, levodopa 25/100 at 7 a.m., 11 a.m., 3 p.m., and 7 p.m. And then the second medication is I am taking Sinemet or carbidopa, levodopa extended release 50/200, 1 tablet at bedtime, which typically happens at 10 p.m. So that will be number one. Now, when we talk about carbidopa, levodopa, that medication is widely available in basically every hospital. Now, let's say that you're taking one of the newer medicines, right? And this is where it becomes a little bit complex. So my suggestion is for you to have just a small amount of medicines, 5 to 7 days of, for example, Nuplacid, 5 to 7 days of Rytary, 5 to 7 days of Gocori, Norians, Xadago, any of these other medications that you might be taking. And you know what? Typically, for these newer medicines, talk to your doctor because your doctor might have samples, right? Talk to your neurologist or your movement disorder specialist usually. They might be able to find a way where you will be able to have at least a small amount of samples that you will be able to set aside just in case that you end up in the hospital. So what is going to happen is the situation comes, right? We're all very upset, my husband, my wife is in the hospital, and it is all suddenly, all you have to do is go home, pick up the Parkinson's disease hospital bag, right? And just take it with you, and all that is going to be there. Trust me, it will be very difficult for you to try to collect all this information last minute and make sure that you're getting that information correctly. So this is very, very important, okay? Now, the other thing that should be inside this bag is the medicines that need to be avoided in people with Parkinson's disease. And I'm just gonna mention probably the most common ones that people may be exposed to in the hospital. Number 1, Phenergan. Number 2, Compazine. Number 3, Reglan. Why? Because these are medicines that are typically used for the treatment of nausea or vomiting, and people with Parkinson's disease should not be taking these medicines. The other situation that could happen is if the person is having hallucinations for one reason or another, they might be having some sundowning. There are medicines like haloperidol, olanzapine, risperidone, medications frequently used for these kind of problems that cannot be used in people with Parkinson's disease because they're dopamine blockers. So they might actually cause a transient exacerbation of the symptoms. So now you see why it is so important that you have all this information in the bag, have the information for your doctor, have at least 5 to 7 days of medicines that the local pharmacy will be able to use to provide to your loved one if they end up in the hospital, because sometimes they might not have access to this medicine, and actually it might take them 5 to 7 days in order for them to get the medicine. So I really hope that you find this information to be useful. I really encourage you to be ready, right? We just don't know when an emergency is going to happen. Once again, if you have any question in the future about this or any other subject related to Parkinson's disease, please do not hesitate to email us. We will be more than happy to create a video and talk about it, see how we can find a solution for everybody. Once again, this is basic advice for all of you, but this is all very reasonable, right? We all must be able to understand how important it is to be ready in case that we end up in the hospital. I hope you find this to be useful, and we look forward to see you watching our next video. Thank you.